multi-million Americans have some sort of thyroid disorders, with women taking the lead. Presenting this topic, we have Dr. Diane Mueller, who is a naturopathic doctor. Dr. Diane is one of the top leading naturopathic doctors with 2 doctorate degrees in naturopathic medicine, as well as acupuncture and oriental medicine. I am Amita from Nourish Doc, a global platform for natural and holistic therapies. I'd like to introduce all of you to Dr. Diane Mueller. Welcome, Dr. Diane.
Thank you. Hello, everybody. It's so nice to be here. And thank you, Amita, and to the team at Nourish Docs for hosting this. I'm really thrilled to be presenting this information. As like Amita said, we have such a global problem happening here with thyroid disorder. And just to tell you a little bit about my own history and how I kind of got in this world, is I had really, really severe sickness. It was Lyme disease and mold illness. At one point, I was actually considering moving to a deserted island because I thought I was dying in my 20s, and I just figured I would live as cheaply as possible and as peacefully as possible until my days were over. But one of the things for me, as we see with a lot of our clients and those with thyroid disease, is that there's a multitude of root causes that tend to cause these disease processes. So even though I had Lyme and mold, I also had subclinical hypothyroidism and adrenal issues and many, many other things. And what commonly happens with conventional medicine and thyroid illness is when we get the diagnosis of hypo or hyperthyroidism, then we're just given some sort of drug or treatment or therapy, and it stops there. And one of the things that I hope to impart on you guys today with thyroid illness is that there is so much more we can do when we actually have the diagnoses. The diagnosis is largely just the beginning. It's largely just the beginning of our work. And so when it comes to thyroid disease, there's a lot of different root causes that when we actually identify the root causes, we can really begin to reverse the illness. So that's what we're going to talk about today. And then can we move forward of several slides? Actually, I think I did several. So yeah, you can keep going.
Oh, yeah, you went on for your history. I mean, your personal. Okay, tell me when we are ready to hear.
Yeah, we can talk about this. So the idea of like thyroid and what we do in our practice is really a combination of getting to the root, which we do by advanced functional medicine tests. So we're looking for things like, how well is the liver detoxifying? Is there any sort of chronic hidden infection? What's going on in the gut? These types of questions we can answer with some of these advanced tests that are really different than what's done in conventional medicine. And then mindset is a really big thing. There's research now that's showing us with mindset that when we think in certain ways that tend to be a little bit more negative, which can happen, right? We're humans and sometimes we have challenging thoughts. But if we don't figure out and teach ourselves to actually kind of control those thoughts and gain control over them, we actually see that disease gets worse. We see, for example, that thinking negatively increases viral load, right? So it decreases our immunity. And we see that infections are a major root cause of hidden root cause of thyroid disorder. So if we can use our mind and our mindset to actually go with the functional medicine root cause lab testing, we can actually begin to get greater control over the root causes of disease. And then by behavioral design, we're really just meaning how do humans change their behavior? And behavioral design, we actually use a model in our clinic called the BJ Fogg behavioral model. It's a research-based behavioral model. And it really looked to say, okay, well, if we are going to do things to help our thyroid, like change our diet, like take supplements, like work on our mind and our thoughts, how do we actually, as humans, how do we actually remember to do these things and change our habits in a way that's going to be successful for implementing the new strategies? And we can skip to the next one too. Okay, so the roots. So I mentioned the roots. And so any of these things that we're throwing up on the screen here, we can find with functional medicine root cause lab tests. So thyroid problems could also be problems in the gut. It could be problems with constipation, diarrhea, nausea, weight gain. There could be autoimmune disease, mood, sleep, headaches, fatigue. So all of these things can be involved in thyroid disease. Oftentimes when we think of thyroid disease, we're thinking of things like weight gain or loss, sleep issues, hair changes, fatigue. But sometimes I find that people aren't thinking about, wow, like headaches and migraines and pain and sleep and mood. These can also be related to thyroid disorder. So it manifests very differently in individual to individual. And so one of the challenges with conventional medicine, and I'm no by no means saying that conventional medicine doesn't have a place, it absolutely does. But like anything in society, we need to know what limitations are of any modality that we're using. And so with conventional medicine, how when we're looking at TSH, for example, and we're looking at free T3 and free T4, when we're looking at the thyroid markers that you guys are probably familiar with, how we establish in medicine the reference ranges of what is normal and what's abnormal with, say, a TSH value is really important to understand. So if we have 100 people that are tired, that have weight changes, that have their hair falling out, that have these classic thyroid symptoms, and 100 people go and get the standard TSH, which is the most common thyroid marker to get run. So we have 100 people, they go get that TSH run. And what will wind up happening from a reference range perspective is we will basically, when we're establishing those reference ranges, we'll say the middle 95 of them are normal. And the 2.5 people that are on the highest TSH and the 2.5 people that are on the lowest TSH, those people are abnormal. So if you're following me, one of the problems with how we're diagnosing thyroid disorder is we're not basing the lab values on healthy populations. And that's when we're looking at functional medicine and how we can really diagnose and work with thyroid disorder. We actually change those values. We actually say, okay, well, what are these values for people that actually don't have thyroid symptoms? And so oftentimes there can be people that are kind of borderline. They don't technically have thyroid diagnosis by conventional standards. But when we actually use the optimal thyroid reference ranges, then we find that actually their thyroid is not working as well. So that's a huge thing with the labs values. And the other thing here is something that I had mentioned at the beginning is one of our challenges is, hey, when we get the diagnoses, that's great, but it's not the root, right? So just because you know you have thyroid disorder, how many of you guys on this presentation actually know why you have thyroid disorder? And if you're answering this by saying, well, because I have a gene, just because we have a gene doesn't mean we have to have a disease. So there's something, even if you have a gene, that is turned on that gene to allow this thyroid disease to express. So in functional medicine, our goal is to figure out what is the root, and if there is a genetic component, what was that thing that actually caused your gene to turn on to express this disease? So my question is, what labs have you guys had done? A lot of people have had TSH. Other common labs that are really important with thyroid is really to get a free T4 and a free T3. We also want to make sure that we analyze for antibodies. It's estimated that majority of hypothyroidism is actually Hashimoto's, which is the autoimmune disease where our immune system is confused and it's attacking the thyroid, and that's what's leading to the hypothyroidism. But what's super interesting is a lot of people are not looking at the antibodies, and that's really important because if our immune system is attacking our thyroid, it's a little bit of a different treatment than if it's a non-immune process. But when it comes to the root cause, I'm curious, you guys, like how many of you guys have actually had a very comprehensive stool culture or a very comprehensive SIBO test or looking for nutrient deficiencies, these types of things where we can actually analyze for what is the root cause of the disease. And so this particular research study is actually looking at the thyroid markers that are being run And so oftentimes we see that for many people, we're really just focused on things like TSH. And TSH is great, but when we actually measure for free T, that's a really important thing. And what this study also showed is that depending upon what the lab company, like the type of mechanism they're using, this ultrafiltration type of mechanism for finding thyroid disease is really important. So what this is saying is that we can have a bunch of different lab companies and they can all be testing for TSH and they can all be testing for free T3, but depending upon the exact parameters of how the lab is working and how the lab actually finds the free T3 and finds a TSH, that actually is going to make a big difference in the accuracy of the test. So it's really important that we understand how a company is actually testing these thyroid markers as well. And so what we see from a root cause perspective, I mentioned several of these things, but when you guys are really looking to say, okay, I want to get to the root, these are the types of things that I would talk to your clinicians about. GI, are there infections in the GI tract? Are there other hidden infections throughout the body? This can be things like hidden chronic viral infections. And I'm not talking about, COVID, although that could possibly be a parameter for thyroid that hasn't been studied that I know of. But what I am talking about here with other infections throughout the body is more like chronic hidden infections. Like, do people have a low level of of Epstein-Barr in their body? Is there other disease processes like Bartonella is a bacteria that I've seen trigger thyroid disorder, and Bartonella is transmitted by insect bites, but also by cats and cat scratches. So those are examples of that. Toxic metals can also be triggers for this. Other environmental toxins can be trigger. Microbiome issues. So do we have enough of the probiotics? Nutrient deficiencies of all sorts, but some of them listed here. Liver detoxification, adrenal issues. If we have high or low levels of the adrenal hormone cortisol, that can impact our thyroid and can impact the ability of our body to actually create free T3, which is the active form of thyroid. That can be very impacted by adrenals. And then also autoimmune disease. So this is a very, very, big list. And when we're really looking at finding the root cause, it's important that we identify all of these different, variety of issues here. So this is really interesting. There's a study, this was a data mining study. And in this data mining study, they basically polled people who had a list of all of these general same symptoms. So these people had inflammation, they had food sensitivities and digestive issues, they had autoimmune disease, sleep issues, diagnosed Lyme disease, immune dysregulation and chronic infections, environmental detoxification issues. And what this study found is that these 200 people had all of these symptoms, but then when they actually did root cause testing to see what they had a combination of what's coming up here on the next slide, which is they had a combination of bacteria, viruses, parasites, fungi. And then on the next slide, we'll see that they even had a combination of mold in their body and pesticides in their body. They also had a combination of a variety of toxic metals in their body and other environmental triggers. So, and then we can keep going a couple more slides. So other things they had were chronic hidden viruses, immune dysfunction, autoimmune disease, inflammation. So there's so many different things, a variety of other types of toxins. And kind of the point of, that study was really to say, wow, we can have 200 people. So we have 200 people with thyroid disease. We can have a multitude of people with a disease process, but we're actually lab testing the root causes, that everybody is going to have a slightly different combination of the root causes that are actually going to lead to the manifestation of the disease in them. So we don't know, as we can't really say, it's not textbook to say that, okay, for everybody has this exact same combination of specific root causes. That's where testing is so important. So with the thyroid specifically, what we see is people tend to have a combination of environmental toxin levels like PCBs, BPAs, phthalates, these things in plastics, metals. Metals tend to be high. Glyphosates are found in GMO foods, and they're also used in the drying process of wheat. Nutrient deficiencies are a big specific root cause for thyroid disease. And then finally, I think we have one more on this slide, don't we? Yeah, the gut microbiome. So these are some of the top things we really want to consider. But, we want to consider that whole big list that I gave a couple slides ago. These are just some of the most common ones that we see in our clinic come up. And so a few more things to consider: estrogen dominance. So estrogen dominance just means that the relationship of estrogen to progesterone is a little out of balance in favor of estrogen. And what we see is when people have estrogen dominance, they typically have, some various menstrual disorders, but we also see when we have a higher level of estrogen that thyroglobulin, thyrotropic binding globulin will increase, and that's going to affect the way that thyroid hormone is able to access and affect our cells. We also see that cortisol, like I mentioned, will increase and cause problems with thyroid, spinal cord injury. So for people that have been in motor vehicle accidents, for example, that can really impact the thyroid. Epstein-Barr, I mentioned, other viral infections such as herpes or shingles could cause thyroid problems. And then, of course, things like iodine and irradiation. A lot of people know that from getting x-rays, that irradiation can hurt the thyroid. Cytokine elevation just means inflammation. So if we have a huge inflammatory storm from something else in the body, all that inflammation can actually negatively affect the thyroid as well. So, and then the next few slides we can go through quickly. These are just, this is just kind of some information supporting some research, basically to show you that what I'm saying has been pulled from research. So we can go through these next slides quickly. So cadmium, mercury, BPAs, other chemicals. So all of these various things, the glyphosates, these are just studies, like I said, microbiome, estrogen elevation. So just so you guys know, here's chronic hidden viral infection. So I just put these in here just so you guys know that, hey, this is stuff that we're actually, pulling from research. We also take our clinical experience, but there is a lot of research to support this, what I'm saying here. So what do we know? How do we know what root causes you have? We test. So we're happy to, to give you guys a free 15-minute call if you guys are interested in what testing we do here, and we have a link for that at the end here as well. So I know we only have a few more, a couple more minutes, so we can go through the rest of this fairly quickly, but just to kind of talk largely about mindset and why mind is so important. So this study is basically showing that the brain and how we think actually impacts our immune system. So clearly when we're in the middle of COVID crisis, this is a big thing, right? We can work on our immune system just by changing our thoughts can actually impact our immune system. And then here's one where we have a certain type of therapy, such as thought therapy, that's decreasing viral load. This particular study is actually showing that when we think negatively, it actually will increase cortisol. And that's kind of the mechanism through which our immune system goes down. And so when we negatively think, our cortisol levels go up and our immunity goes down. So we really want to spend, and what I recommend to people is take the first 2 minutes every day and just do a gratitude exercise, get oriented for the day so that whatever challenges we come across during the day, we've at least started the day by trying to focus on, on positive things. And there can be a lot going on in our lives, but, still finding that silver lining sometimes takes a lot of effort, and sometimes it's really hard. And in certain situations, sometimes it feels pretty impossible, but trying to continue to come back to that can really, really impact our thyroid, our stress response, our immune system. This is an interesting thing for people that this study showed that when we have something going on in our life with our health that's challenging, circular thinking and thinking about it a lot actually makes the health situation worse. So that's really interesting because we actually can change the circuitry in our brain so that when we're thinking about, wow, this is so hard, I'm so tired, right? I've been there. I went through Lyme treatment. I thought I was dying. So I really, really get this one, with the bottom of my heart. And it's important that we're aware of the fact that this research does exist to say, like, hey, even though this is a natural human tendency to do this, intervening and learning how to control these thoughts is so important, because we actually see when we control our thoughts, our symptoms, lessen. So it's so important that we're working with the body, figuring out the roots, but also like not ignoring how powerful our mind is. And then behavioral design is really looking to say, how do we motivate ourselves? So this tinyhabits.com goes over this in a lot more detail. You can also get a great book called Atomic Habits, which goes over this theory. But what I recommend is that people start from a mindset perspective with that gratitude exercise, with maybe some breathing exercise in the morning, with something that's going to help regulate their nervous system. So we start the day out really well. And then we add all the physical things we can do for the thyroid on top of that. So I definitely recommend you check out the book Atomic Habits, because that will really teach you this behavioral design process of how we actually as humans motivate ourselves and use cues and make sure that wherever we're working towards and our goals, that there's some ease with it and we have the ability to do it. And so we don't have time to go into this full thing today, but in order to kind of implement a lot of the mindset and a lot of the functional medicine treatments, I definitely recommend you check out Atomic Habits. I've read it multiple times now. It is so phenomenal for just bringing a higher level of of showing up in the world. It's so wonderful. And so to put it all together, start working on the mindset. Start with gratitude exercises and breathing every day to really work on the mindset. And then step 3 is really understanding how to make, mindset and taking your supplements and changing your diet, all these things stick. So then get that book, Atomic Habits. I will go through that in a lot of detail for you. And so do we have, I know we're
yeah, you can take time. You can take more time. Absolutely. Please finish. Take extra, whatever time you need. That's fine.
Okay, great. I just want to make sure I'm respecting everybody's needs here. So client example, just to kind of teach you guys how this kind of goes at putting this all together. So here's somebody that was 68, insomnia. She was on thyroid medication. Labs were still showing that she was hypothyroid despite trying all these different meds. She had fatigue, some heart palpitations. She could feel her heart beating. So there's a lot of, common thyroid things. And so we see this particular lab where we see a classic hyperthyroid situation. And so we start seeing that, okay, she had free T3 and low TSH. So it's really interesting because she was somebody that we see, this will happen to people a lot, where they are actually bouncing between low and high thyroid values. And so sometimes it looks like they're over medicated. Sometimes it looks like they're under medicated. So that's super interesting. And part of what we also found with this particular woman was iodine was actually what was largely causing her to go into this standpoint when she was actually hyperthyroid, when she had too much thyroid hormone. And so that was really interesting. And that's what I see oftentimes with iodine is like, even though iodine helps the thyroid, in many cases, there's a very narrow window of how iodine can be used. So if people use iodine, I do recommend that they're getting their labs tested every 3 or 4 weeks, because how it affects people on an individual basis is so different. And then other labs we found for her, so we found MPO, which showed some inflammation of the heart. We also found, can we go into the next one, please? We also found kidney inflammation. And then on the next slide, we also see that she had low testosterone, and the DHEA up there was low. So this treatment phase for her was first getting her reducing that synthroid, because like I said, she was over medicated. We also wanted to start working on the adrenals a little bit. We also wanted to start working on some of the blood sugar. We didn't show you the blood sugar here, but the blood sugar was also out of balance. So that was a large portion of what we were working on, was adrenals and blood sugar, and then decreasing that thyroid medication. So after we did that, then let's look at the next slide here. So can we keep going from there? So then the next steps we did, oftentimes we do things in steps as far as testing. So the next thing we wanted to look for is we wanted to look for MARCONs, which is a type of staph that lives way far back in the sinus cavity, like way far back by the ear. So we wanted to look for that. We also did some additional deeper adrenal testing. Blood adrenal testing gives us kind of a snapshot in time, but urine adrenal testing that's done throughout the day gives us more of a large picture of if there's an adrenal problem. So the Dutch testing is like further looking at the adrenals. And then from there, we also wanted to repeat our thyroid testing to see how she was doing. So on the repeat, which I believe is on the next slide, we see that the Marcons, the staph was negative. Here's her adrenal. So we did see that she has some low cortisol levels here. So that definitely is showing us an adrenal problem. And then on the next slide, we can see that we have, so blood sugar has improved a little bit. It went from 102 to 93 fasting. You can also see the one below that her kidney function was improving. So this is good, right? This is the reason we do testing kind of pre and testing throughout. And that's what I would recommend you guys do, is because even if we're not there yet, even if symptoms aren't totally gone, when we start to see that certain numbers are improving, we can start to say, okay, well, people are making progress with their work. And then on the next slide, so mindset for her. So we identified some of the negative thoughts that we're not serving. A lot of how we do that is we actually have people carry their notes app on their phone or a journal, and they basically just kind of every time they think something that's like, wow, this is maybe not the most helpful thought, they just write it down. No judgment. The point of this is just to bring awareness to what's happening in our mind, because oftentimes these thoughts we're having are largely subconscious. And I've been doing this exercise for many, many years. I still do this exercise about once a quarter, just to check in and say, are there thoughts that are not helping me, that are sneaking through and I'm not even conscious of them? And if we are aware of them, then we can find ways to change them. So once we did this for her and she had this list, then we basically had a discussion around like, okay, well, what did she think that would be more serving for her from a thought perspective? So she can begin then to create the mind and the thoughts that she feels are best for her life. So that's kind of what we do from a discussion standpoint. And then the next point on this screen is basically then the plan to incorporate the new thought process. So like I said, it's a long conversation, the behavioral design portion of it, but a lot of what we do, from a simple standpoint, is helping people have like cues or reminders or prompts. So like, if we're thinking thoughts like, wow, I'm never going to be able to get well, that is not probably helping our body, right? Because even when I say that, I feel a little anxious inside. So a better thought could be something like, I believe that I am working towards actively healing. And it doesn't mean we have to be there yet to have a more positive frame, but then we can use things like doors. Like doors are really good cues, so that every time we walk through a bathroom door, a bedroom door, an office door, a garage door, car door, any of these things, we can use doors as a cues to think that positive thought. And the more we think it, the more we're actually rewiring our nervous system. We do it enough times. It's just like learning an instrument, learning any new hobby. We do it enough times, and all of a sudden that is the new habit. So we can use cues like doorways to practice the new habit.
So do you have a psychologist who you engage with when doing the mindset and the behavioral designs?
No, we do all this with like our health coaches. We do this as, as doctors. And so it is within our scope to talk about thoughts. It's not in our scope. And when we do refer people to a psychologist, is like somebody has, say, some sort of trauma and they need to process that trauma. That's where we really need to get a professional involved. But we can, within our scopes, talk about like the thoughts that we're having. Okay. That's how we differentiate it. Yeah,
absolutely.
Yeah. And so I think we can skip this one. We kind of already talked about doorway system. So, and that's basically how we work. So we definitely work as a clinical team. So I definitely encourage you guys to, all these things that I mentioned, functional medicine, behavioral design, mindset, all of these are really, really important in healing your thyroid. So we work as a team-based approach at our clinic, but sometimes you might be working with somebody that you find is just awesome and you love them and they're really helping, and maybe they're missing the mindset or maybe they're missing the behavioral design. So I really encourage you guys, if you're not working with an office that has a whole team, to build your own team. And if you're working with somebody that does something like mindset very well, awesome. Keep them on board for mindset. And then just see if you can add, that functional medicine, and that's somebody that can help you with that lifestyle type of behavioral design, almost like a life coach type of thing. And that way you can make sure that all of these aspects that really, really help the thyroid and really help us heal are included in your process. And so that's really, I think we can skip this one. I think you guys got that. That's really the formula, something you can stop right away. Gluten, we see to just be bad for the thyroid. There's so much research connecting gluten to the thyroid. So even if you're not feeling like, oh, I eat gluten and I get sick, and or you have stomach aches, it can still really impact the thyroid's ability to heal. So I do really encourage you, if you're on gluten, to stop gluten. And then also another thing I really do encourage you is to do this exercise. Do it for a day. Take your notes app, take your journal around, look for those negative thoughts, start working with doorways as your prompts and cues to impact, your thoughts positively. So I would definitely encourage you guys to just not wait, just, start making at least some of these changes right away while you're hopefully doing some of the functional medicine testing and looking for the roots. And so another thing is just to, consider is, how are you going to motivate yourselves? And the Atomic Habits book will talk a lot about how to motivate yourselves. But, for me, a big motivation is just like being able to participate in life and doing the things I love. And when I was really sick, I couldn't snowboard. I couldn't do my outdoor sports. And as an athlete, snowboarding is one of the kind of the holy grails of amazing things for my soul for me. And this is my husband, Dr. Miles, and I at the at Vail, Colorado. And this sport was stripped from me for some time. So now I have this sport bag. Now I can be an athlete again. And it was a huge motivation for me during these really, really challenging times, because I had to have something to, motivate me to continue to try and to not move to that deserted island. So, I put this in here just to kind of encourage you guys to really, some days are really, really hard. And it can be really frustrating with thyroid disease when we feel like, gosh, like we can't get this regulated. It can affect our self-esteem if we're having a hard time with too much weight loss or too much weight gain. Both of those are such big problems. And and it can really impact so many different areas of life, and it can be hard and take time to get to the root. But think about, what if you got to the root and your thyroid was managed and you were, feeling so good in your body, and you had all the energy to do, what you love? What would you be doing? What would you be doing if you didn't have to focus on your health so much, and that you could just do small things every day to just kind of maintain, and use that as a motivation to, to do the hard work on a daily basis to get yourself to where you want to be. And that's pretty much it. I encourage you guys to continue to find people to work with you. Definitely reach out if you are interested in that free 15-minute call. And as always, thank you so much to Nourish Docs and to Amita and your work. It's truly been a pleasure to be on your show again.
Thank you. Thank you so much. And we have quite a few, attendees in Zoom. You are welcome to
Wonderful.
ask questions. Do you have a few minutes, Dr.
I
Diane?
do. I do. Yeah, I would love to answer some questions.
Okay. So yeah, if, you can type it up in the chat window, or if you have this more detailed questions that are personal, I'll stop sharing and you can ask her questions. No problem. So we have a few minutes. If you want to, you're welcome to do that right now while you're thinking of the question. So I was just going to say that how many tests, like you mentioned, so many different things that could be root
Yeah.
causes, like from inflammation, so many things. So how many tests would you do to incorporate, to try to figure out what the root causes are, like on an average, like there are 5 or 6 or more or something like that?
So it kind of depends upon what we're actually, how we're defining test number, because
Yeah.
we run, for example, this amazing panel through insurance, through this company that we can get insurance coverage even for like
Oh,
Medicare, Medicaid. And with
great.
that company, we get about 100 different markers from that company. So that kind of, we look at as one test because we run it under one panel, but we get about 100 markers under that test. And that one,
Okay.
like I said, is insurance based. And then beyond there, we tend to run, typically for the average person, another 4 or 5 tests on average. And that's a really good starting point for people.
Yeah.
Sometimes then we have to run more throughout our time together, but that's about average of where we start.
Okay, so there's a question someone is asking, is there a special diet that would help with this disease or a food that I should not eat?
So definitely gluten I would stay away from. There's also some evidence that certain things in foods like lentils and that type of like our legumes food can be good to stay away from. I find if it's a autoimmune condition, doing autoimmune paleo is a really, really good diet. But for everybody, honestly, it's going to be different. So if we're trying to figure this out, what I would recommend is look up autoimmune paleo. That's a really, really good place to start. Do that for 21 days pretty solidly. And then if it feels like it's too restrictive, try adding in a food at a time, like a food every few days, and see if you add the food in. Like, do you notice, do you feel a little more tired? Do you feel a change? And you can kind of work almost like from an elimination standpoint that way. But as a broad answer for that, most people, if we're just speaking like across the board for thyroid, I see most commonly the autoimmune paleo is the best diet.
Okay, and then someone is asking, when is surgery necessary to remove the thyroid? So at what point I think you have to have the surgery done?
Yeah, it's a really good question. I really hesitate about
Yeah, okay.
removal of body parts.
Yeah,
So
that's good.
that to me is like the last case like option. Like, the one time would be okay if somebody has something like thyroid cancer,
Yeah,
but I would really, really try everything. If it's not cancer, if we're talking a goiter, if we're talking just nodules that are non-cancerous, if we're talking anything other than cancer, I would really, really hesitate to do that because it's a very tricky, slippery slope when we start removing glands and organs that we can actually cause more harm sometimes than good. So I would definitely encourage you, if you're considering thyroid and it's non-cancer, try everything else possible before you go that route.
yeah. No, I think I couldn't agree more. You don't want to be messing with your body parts, right? Um,
Yes. It's a pretty irreversible decision.
that's right. That's right. Any comments, feedback, questions? We could take a couple of. All right. So someone is saying, after how many months or years on Synthroid or other conventional medicine, is it too late to go off? Meaning they need to take it off for life.
I've never seen that there's like a time period where it is totally impossible to, get somebody off of these medications. So the biggest thing really comes down to, can we figure out the root? And then are you willing to put the time and the effort into, to reversing the root? For example, if we see certain parasites come up on on a stool culture, sometimes like to get rid of parasites, sometimes people respond really quickly. Sometimes it's a 6 month to year treatment that to really get some of these deep pathogens to eradicate. So more of the question is how willing are you to continue to try. But
Yeah.
this whole thing, I have people come in frequently that say things to me in the clinic, such as, I've been told that that I always have to be on Synthroid, I will never heal, and that my thyroid is going to basically get worse and eventually fail. So I'm curious, this question might be coming from hearing something like that, because it is something that my clients report to me that they're told. But I actually typically find that even for people that have been on Synthroid for many, many years, decades, we can reverse the thyroid disorder. And that unless it's something that's really, really severe around like, cancer or something like that, that if we're really finding the root, even if this has been going on for a long time, the chances of still being able to reverse it are pretty high if you're willing to invest, the time and effort.
Sure, sure. And the follow-up to that comment is, maybe the
Yeah.
body feels a dependency that's too hard to switch off, question mark. Is that what happens? Like, body's so used to
I mean,
synthroid.
that certainly can happen with certain hormones, right? We do see that there is a dependency, but
Yeah,
what typically happens and what I've seen usually when we are working with hormones is that when we slowly wean somebody off, that
yeah,
actually starts sending the signal to the brain to say, oh, this isn't available anymore, so maybe I have to do my job. Because there's definitely that thing we've seen with hormones in general where it's like, okay, if we're taking this orally or we're taking it in some other fashion, there is a signal to the brain that says, hey, you don't have to do this job. But that's why stopping hormones is like a really good thing to not do cold turkey and to do the weaning process, because what we're really doing is sending that signal to the brain that says, hey, there's not as much of this available. So now you need to actually come back in and send the signal to the thyroid to do its job, which if we've removed the root causes, then that process can happen again.
yeah, yeah, that makes sense. Any other comments or questions? And if you want to book a discovery call, I've written our email there, care@nourishtalk.com. You're welcome to book a discovery call. Like Dr. Oh, wow, there's a big question here.
Yes.
Okay, so hi there. My grandmom, mom, and brother all have thyroid disease. My mother also has lupus. I have shown slight signs of thyroid disease, but my tests always come back within a safe range. My conventional medicine doctor seems to think I am being paranoid. Would it be safe to assume if the disease is so prevalent in my family that I could carry the disease even if it's a lighter case?
It would, if you have a genetic tendency to have thyroid disorder, I would say that yes, you probably likely have that gene. Now, remember that just because we have a gene does not mean we manifest that disease. So remember that we're not, luckily, we're not victims to our genes. There are more things that are happening in the body to turn on the genes. That being said, like I said, and I don't know if you were I don't know, Jordan, if you were on the call when we were actually talking about the reference ranges. So that's the reason why I had that conversation about, hey, conventional reference ranges being based upon a sick population of people and not a healthy population of people is because in situations like yours where you're saying your tests come back within the safe range, I
Yeah.
often find that people they come in and they say, oh yeah, my thyroid's fine. My conventional doc told me it was fine. And I look at them and I'm like, well, actually you're not, your thyroid isn't working optimally. So it's also possible that what's happening here is that, hey, yours are in the conventional range, but yours aren't in the thyroid is working range. And especially if you have symptoms, I would definitely recommend getting your labs looked at by somebody that is more functionally minded to make sure that your thyroid isn't just like non-disease, that is actually that your thyroid is functioning optimally.
Yeah, yeah, yeah. No, no, makes sense. So the question on one of the things that the person who had asked about the dependency, on the medication.
Yeah.
So the follow-up comment on the same discussions, he or she is saying, not that this is typical, but what is the soonest number of weeks or months you've had success having patients to be off their thyroid medicine, if someone wanted to see you? So in your opinion, how much time it has taken in your
It's so varied. It's honestly one of the most common questions I get and one of the hardest to answer. So I've seen situations where it's as few as 3 months. I've seen situations where it's as long as 2 years.
Oh,
So a
wow.
lot of that is dependent upon when we do a lot of these advanced tests, how
Yeah.
many different root causes come up, and then how easy it is for somebody to do the treatment protocols. We find for some people it's a lot of work to change diet, and it's a lot of work to remember supplements, and it takes a long time for them to develop the process of doing some of these recommendations. And those people, it tends to go slower. If you happen to be somebody that is more of a quick start with implementing things, then often it goes faster. But typically we can give a better sense of that once we have that first visit where and we order a bunch of labs. And
Yeah.
then on that, when we go through that lab review and we say, okay, these are the different things that are the root causes, at that point, we can give a much better trajectory because we actually know what we're
Mhm.
working with.
Yeah, yeah. And the labs, okay, thank you. That's the,
Yeah,
all right.
great.
Any more comments, final comments, questions? It's you have, we can take one more question if you have. or anyone has one more question or anything? I don't want to, tell people time is up now.
Right. Yeah, no problem. I
That's
have a
what
few
I
more
end
minutes.
up doing, but if it's an engaging conversation, I don't want to say that. So,
Totally.
okay, any more comments, any questions? All right, so if someone is asking, the complimentary call, I said care at Nourish Talk, you're welcome to send us an email and we'll direct you to Dr. Diane's office with all the details, no problem. So, right, Dr. Diane, and we'll
Yeah, exactly.
and then the discovery call, whatever her process is, she will help you. That's how it will work. That was a question that came up. Okay, very informative. Thank you. Thank you so much for attending during a weekday.
Yes, thank you, everybody.
All right, so I'm going to wrap up now. I just wanted to say if there was any. All right, so I'm going to wrap up. Thank you so much, Dr. Diane, for being with us. Thank you, everyone, for listening during a weekday. And any last comment from you, Dr. Diane, before I wrap up?
No, just thank you again, Amita, and thank you everybody for your questions. It's always so much fun to talk to an engaging audience. So I appreciate everybody's attention.
Yes, thank you. And if you want discovery call, please email us and help us share this session. Dr. Ann is doing amazing work, so please help us share the session. That's only my request. Thank you so much. Bye now.